when you are dealing with headaches, when somebody comes in with a headache, I would love for the general public to get an idea of how you think I'm going to approach this headache. What are the questions so they can start becoming more aware of it?
Absolutely, absolutely. And so when I hear a patient, the first thing I want to know is, how many headache days are you having in a month, right? Because that helps me identify, is this somebody that's having, episodic headaches or chronic headaches? Anybody that has 15 headache days or more a month, it's chronic. Mm-hmm. And then I also want to know, have you had a period of time where you had fewer headache days? Is there a seasonal component? Because that leads us one direction. Is there a positional component? And then I also want to know, am I hearing any red flags, right? So first things first, is this your first headache of life? Or have you been having headaches for a long period of time? So the first thing I ask patients is, when was the first time you had a headache? And probably 50%, and at least the data supports this as well, have had their first, in terms of migraine, before age 12. Mm-hmm. So a lot of my patients are like, I don't remember even not having headaches. I've had them forever. Mm-hmm. And many of them are trying to find what caused that to happen, right? Like, is there something they did? And so we go a little deeper and do you have family members with headaches? And then has anything made it better? Anything made it worse? Do you feel like you have any triggers? And by the time people come to me, being an academic center, they've usually tried a variety of different things. They've seen other neurologists. They've had head imaging. And many of them come in with the impression that maybe they just have what we call tension headaches. And later we realize that no, in fact, you have migraine or probable migraine, or you have some of these other headache disorders. Mm-hmm. So these are the things that I kind of start a visit with. There's just so much to find out about a particular patient, and everybody has such an interesting story. Yeah. And it really takes at least a good hour to get to know a story and understand what kind of headache type they have and how can we best go about treating it.